Hello everybody. First let me introduce myself. This is me, Shahd Ayman, a student at Faculty of Medicine first year. Today I'm gonna talk about bacterial meningitis. This is our teamwork. This is a table of contents. First I will talk in the introduction. Our case is a 10-year-old child. The symptoms that the patient was lethargic and had a stiff neck. Examination: a lumbar puncture revealed that the cerebrospinal fluid had an increase in number of neutrophils, a high protein level, and a low glucose level. The diagnosis was bacterial meningitis. First, let's know what is meningitis and how is it caused. Meningitis is an infection and inflammation of the fluid and membrane that surrounds the brain, which are called meninges, and also the spinal cord. It can be caused by different bacteria or viruses or fungi, but the most common one in children is Neisseria meningitidis bacteria. Types of meningitis and how to differentiate between them. There are two types of meningitis, which are septic meningitis and aseptic meningitis. Septic meningitis, it is a meningitis that is caused by a bacteria, and the aseptic meningitis, it is a meningitis that may be caused by virus, fungi, Mycobacterium tuberculosis, or spirochetes. Knowing whether a virus or a bacteria causes meningitis is very important because the severity of illness and treatment differs. Where the viral meningitis is generally less severe and resolves without specific treatment, but the bacterial meningitis can be severe and may result in brain damage, hearing loss, or learning disability. Therefore, bacterial meningitis is a medical emergency that indicates prompt initiation of antibiotic treatment. How to differentiate between septic and aseptic meningitis? We differentiate between them from the cerebrospinal fluid findings. As we see that the normal person, the aspect of the cerebrospinal fluid is clear and the leukocyte number is from 0 to 5. Predominant leukocyte is lymphocytes. Glucose level is 45 to 85 milligram per deciliter, and the protein level is from 15 to 45. In the septic meningitis, the aspect is cloudy, and the leukocytes number from 200 to 20,000 per milliliter. The predominant leukocyte is neutrophils, glucose level is low, and protein level is high. Aseptic meningitis or viral meningitis, the aspect is clear, and the leukocytes number from 100 to 1000 per milliliter. The predominant leukocyte is lymphocytes, the glucose level is normal or low, and the protein level is moderately high. The importance of neutrophils in the CSF. As we know in diagnosing that the findings of the cerebrospinal fluid in this case showed a high number of neutrophils, and this means that the type of meningitis is bacterial meningitis and not any other type. It's septic or bacterial meningitis. The question is, why does the neutrophil number increase in this type? The neutrophils release neutrophil extracellular traps or nets during infection to trap and kill bacteria. The onset of bacterial infection results in the activation of both non-cellular and cellular components of immune system, with neutrophils among the first immune cells that are actively recruited to sites of infections. The CNS lacks extensive neutrophil immune surveillance during healthy conditions, while during acute bacterial meningitis, a massive neutrophil recruitment occurs across the blood-brain barrier to eliminate bacteria. Why does the glucose level decrease? During meningitis, there is an increased metabolic demand due to the inflammatory response, like when activating white PCs such as macrophages and lymphocytes that use it as a source of energy to carry out their functions, as well as the presence of bacteria in the CSF, which use it as a source of nutrition to replicate. This increased metabolic activity can lead to rapid consumption of glucose and can result in lower levels of glucose in the CSF. Why does the protein level increase? Elevated protein levels in the CSF increase during bacterial infection due to the increased numbers of replicating bacteria and the body cells fighting the infection. As a consequence, both of them have a high concentration of protein. Not to mention, damage in the blood-brain barrier could often cause trauma, allowing the protein to leak into the CSF. In initial diagnosis, what is the laboratory test that should be done? Initial diagnosis of meningitis can be made by clinical examination followed by a lumbar puncture. And a lumbar puncture is performed with patient lying on one side of the table. Then a needle is inserted into the lower part of the spine and a small sample of cerebrospinal fluid is withdrawn, from which the bacteria can be analyzed under the microscope after using gram stain. In this case, the bacterium is gram-negative diplococci, and it would resemble a pair of kidney beans, which would allow a definitive diagnosis of meningitis. There is another method for direct detection of bacteria, which is direct antigen detection of bacteria by latex agglutination test in the CSF or blood. Those are our references, and thank you for watching.